I think I see more people wearing masks now than ever before, and that's so not helpful. I'm not a scientist, so that's as far as I'm going with science. Then there's law. This just isn't how it's done. This isn't a legislative branch. This isn't how laws are made. And I hope you do understand that there will be a lot of non-compliance with this. And that leads to my last point of South Republic Health District does a good job for our communities in keeping people safe and healthy and doing a lot of great things for people. But you're also tasked with doing no harm. And this is doing harm. This will harm people. This might physically harm people. It's most definitely going to mentally harm people. And for that simple fact, if you forget everything else I said, do no harm. I believe that we'll do the right thing if we stay with that. Thank you for your time.
Thank you.
If you forget everything else I said, do no harm. I believe that we'll do the right thing.
My name is Kim Johnson. I am from Cameron County. We are experiencing a new virus and we are experiencing at this moment. We are experiencing a new virus and we have always been in that practice for years, years past. We have always been in that practice. If a mask mandate is put in place to pass students this year, disagree. If a mask mandate is put in place, right, students, the Department of Health is not voted on by the people positions. We do not have the authority to make laws. Not voted while you have been given certain powers by local government and representatives. While you have been given certain powers such as the mask mandate. I have the freedom to define advices such as advice procedures. I have the freedom to define advices. I think we still live in a free America, do we not? This name mask, I think we still live in a free America, do we not? This through the Department of Justice, we still live in a free America. Deprivation of rights, this through the section of W2. The government, the deprivation of which you are acting as representation of, subject city for deprivation, which you are acting as representation of the It is quite sad to see our local entities perpetuating this. There are many other viable and reasonable options in educating the populace and personal. There are many other viable solutions without violating our constitutional rights. This virus, which has less than half our mortality rate, like every other virus, which has less than half needs to run its course. Like every other protects your immune system, and that's needs to run its course. Only make matters worse. We are seeing nasty nothing but things that this virus only make matters worse. We are seeing nasty. There are many better discussions. There are many better discussions. There are many better discussions.
I'm Elizabeth Lees. I'm 80 years strong. I did everything that I was told. I'm 80 years. I nearly died. I did everything that I was told. I got COVID. I nearly died. I'm also a CNA, by the way. I got COVID. I'm also a CNA pneumonia. My doctor said I'm lucky to be alive. CNA pneumonia. There's studies that have been done that a mask cannot help. God created our bodies to be loved, to be touched. God created our bodies to be loved. That's what keeps our immune system going. In 2004, I went immune system going in the 2006 weeks. I went immune system going 200,000. I was not in good health as I was. I was not. I spent lots of time with people dying of TB. I spent lots. No, I didn't wear a mask. I didn't wear gloves. I spent lots. No, I didn't. I was also designed during the swine flu. I spent lots. I was also designed during the swine flu. This is ridiculous. You are taking and creating. This is ridiculous. You are taking and creating. The reason the numbers are going up is because we've been forced. The reason the numbers social distance, the masks, and I watch people with masks always having their hands on their face. And I watch people with masks always having their hands on their face. Yes, clerk has her gloves on, but she touches everything. Clerk has her gloves on. We don't know if she touches everything. And where's her hand? We don't know if she. So, quite frankly, I'm fully against it. And if you want to find me, that's fine. I will go down hollering. I trust God Almighty, and I would pray that all of the rest of you do too. Thank you.
Thank you.
I thought this was America. I didn't know we were coming to Nazi Germany again. I come from a very military family, clear back to Spanish American War. What do you think this is making them feel? The men and women that have given their lives, and yet you want to create.
We'll keep your thoughts in our thoughts.
Pardon?
I said, we'll keep your thoughts in our thoughts. So thank you.
Thank you.
Next.
Good afternoon. My name is Shailene. I emailed a lot of people yesterday and talked about my path of masks. I worked at our local hospital, and because I chose not to get the flu shot while pregnant, I was required to wear a mask full time. After almost 8 months of wearing the blue mask that a few of you are wearing, I ended up getting a lung infection to the point that I couldn't breathe. Couldn't get off my bathroom floor. I have 2 small kids that I take care of, and I couldn't move. And my doctor very quickly told me it was because I was wearing a mask 12 hours a day, 7 days a week while I was working. The thing with the blue mask that I'm seeing, a lot of people don't seem to understand you're supposed to wear them for 30 minutes at a time and toss them. I see them in my child's school being worn all day long, touched, sneezed on, rubbed in their eyes. It's not healthy. When you work at the hospital, you are properly trained in PPE. You're trained how to put gloves on, how to take them off, how to put a mask on. We are also fitted with N95s. Put a mask on your face and they spray something in your face. You can smell it, the mask doesn't work. I guarantee all of you I could spray perfume and you smell it. It's not working. Please don't make us criminals. Don't make my kids criminals by not wanting to wear masks, because we won't. Thank you.
Thank you.
My name is Sylvie Ray, resident business owner in Haley, Blaine County. I consider myself a scientist. I use the scientific method. I have a biology degree, worked in biotechnology, and now run an herbal business. I've spent thousands of hours investigating biology and reading medical journal articles. Being tasked with this very important decision, I assume you all have a biology degree and that you have the ability to read scientific articles as well. You must all have done extensive research into the randomized clinical trials published on the effectiveness of masks for both source control and to prevent infections in healthy people. You obviously have been faced with the fact that not one actually scientific controlled trial has found any significant difference in infection rates from wearing masks. We're talking about observational studies with tiny sample sizes and bad methods. Some of these have even found a higher infection rate when the healthcare workers wear cloth masks versus surgical masks. You all know this? Then why the obsession with masking our entire population? What is going on here? Are you really threatening jail time for this? What is driving this order? Pressure from the governor? Pressure from citizens with no biology education and completely consumed with fear? The hospital's begging you to do something, anything, even if it's something that doesn't work and couldn't possibly make a difference? Here are the hard facts. The medical literature for the past 45 years has been consistent. Masks are useless in preventing the spread of viral disease, and if anything, are unsanitary objects that themselves spread bacteria and viruses. Mandating mask usage will not reduce the infection rate. It will not reduce hospital admissions. It will only anger the population and cause them to lose trust and respect for you. If you at all care about the public, if you care about our health, you will vote no on this order and instead go back to the drawing board and consider other options that would actually make a difference. I do not consent to forced masking, and I will not comply with unlawful edicts from unelected officials.
Thank you.
My name is Esther McLaughlin. I live in Blaine County. I live in the city of Haley. Our source created its children in the image of its divine perfection. Our breath is the spark that animates the physical form and is a direct connection to our Creator. When the physical form sucks oxygen through a resistant force, like a mask, it sends the body into a pseudo-hypoxic state, a lack of oxygen. This stimulates the sympathetic mimetic drive, which is also a sympathetic tone known as fight or flight. The stress on the body raises cortisol levels and suppress the immune system. There are many famous people that talked about historic reoccurrence. George Santayana said, "Those who do not learn from history are doomed to repeat it." I'd like to take you back in time, 87 years, to Germany. There was a man named Joseph Goebbels. Hitler appointed him Minister of Propaganda. His job was to exert control over news media, arts, and information. His tactics were anti-Semitism, attacks on churches, attempts to shape morale, and close businesses that were considered non-essential to their war efforts.
I just called the phone number.
In time. Will you perpetuate these abuses on humanity, or will you stand with your brothers and sisters and say, no, this is not right? We all have a right to go ahead and say, we don't agree. Thank you.
Thank you.
My name is Phil Rainey. Haley, I own and operate a medicine facility there. I've been in business for 8 years doing this. And we deal with science, chemistry, biology, and physics. I'm here today to talk about something that I believe is getting missed in this whole ordeal. We treat a lot of traumatic brain injury and PTSD, and it comes in various signs and shapes and sizes. We also treat autism, and I think something that is getting missed is that there's a huge population out there that cannot tolerate masks or shields. I deal with that. I see that every day. These are some images of brain SPECT scans that are taken of some of these people, and they you wouldn't know them from anyone else. These don't show up on MRI. They're SPECT scans. They're expensive. They're about $5,000 a copy, and they're not covered by insurance. So these folks have images and have injuries that we treat, and many of them don't tolerate masks. A lot of them do, but you don't know until you do that. There's a lot of people out there that didn't know whether they could tolerate a mask until this whole mandate happened. So I'm not saying that people shouldn't be wearing masks. I'm just saying that please consider those folks and their tolerance or intolerance. Thank you.
Thank you.
Hi, thank you for letting me speak today. I appreciate that. I just wanted to recognize that your concern here is for our health, for the health of the community, and I appreciate that. I want here to ask you to respectfully consider that those of us who have chosen not to wear masks also very much have the health interests of our families in mind. We've spent hours researching, looking into the issues. We know our families better than anyone else. We know our children and what their issues may be, like with their lungs, etc. I'm very concerned for the health of those workers when I go to the store and I see those who have to wear a mask all day long. Masks, so many problems, headaches, respiratory issues, low oxygen levels, rotting teeth, just to name a few. And like I said, I believe that as individuals, we are the ones who need to make, or the only ones who can make health decisions for ourselves. We appreciate recommendations, but no one else has the authority to make a health decision for me, for my children, except for me and my husband. I am also wanting to say that it's inconceivable to me that the police would have any part in getting involved in these issues. A couple of months ago, one of my friends in Boise found that next door to her was living a man. The police came. He was a sex offender with 3 warrants out for his arrest. They talked to him, said, "We can't take you to jail right now because of COVID. We'll meet up with you later." And why in the world would they be taking, even threatening to put me in jail for not wearing a mask if they can't take the real criminals to jail? So please consider that. Also, I have concerns about the trustworthiness of the test. I've heard of more than quite a few results that were questionable, false positive testing, and from what I understand, we're more likely to die from getting struck by lightning than from this virus. I'm sorry for those who have been affected by it, but I believe that ultimately we are responsible for our own decisions. Thank you very much for letting me speak today.
What is the name and residence of the last speaker?
Oh, ma'am, your name and where you're from? I'm sorry, go ahead. Okay. Yes, my name is Jody Cruz. I'm from Buell, Idaho.
All right, I'd like to start by saying that I appreciate y'all letting us speak today and have a minute to speak our grievance against what's on the table here. My name is Matthew Beaver, and I live in Gooding, and I pastor the Solid Rock Baptist Church there in Gooding as well. And I'm here today to say, as a spokesman for Solid Rock Baptist Church, as a citizen of Gooding and a citizen of the United States, that I do not support a mandate of any kind. I moved here last year from the state of North Carolina, and I've seen the effects of liberal policies such as this mandate. And I don't want to see Idaho turn into the same state that I moved from. The thing that I could be fined $300 or 6 months in jail potential for not wearing a mask is crazy to me as a citizen of this country, the state, and the county that I live in. I love this land, this state, the county I live in, and to think again that there's a policy on the table criminalizing me for exercising my constitutional rights to life, liberty, and pursuit of happiness dumbfounds me. As a pastor, a citizen, we support our law enforcement. We're heavily involved in our law enforcement there in Gooding with the city as well as with the county. And we often have prayer time for them, support them, and talk to our sheriff there very often about things going on in our community. And to think that that would potentially put those that we support in a position to have to enforce these things is not good in my honest opinion. Just to consider that. But in closing, I want to say that you guys are in our prayers. I appreciate, the concern for the overall health of our communities. And, as a Christian, as a Bible believer, as a pastor, I have, those things. So you are in our prayers, and I appreciate your time today. Just go on record that if it does pass, that I intend not to. Thank you.
Thank you. Next.
See? Do you want my name and where I live?
Name and at where you live.
Leslie Manukian from Ketchum.
Okay.
And I understand you three are board members and you three are not, is that correct? Okay. I totally appreciate that you all are in a very difficult position. I want to talk about two things. One is history, and two is the tests that are being used. So if you look in history, the doctors have always clearly tried to do their best. But if you look in history, there was a time when we x-rayed pregnant women's pelvises just to see if the baby, how it was positioned. We now know that's insane. Doctors have prescribed drugs like the thalidomide for morning sickness, which ended up causing birth defects in thousands and thousands of children. In recent years, we've seen the Viac scandal, which some people estimate took up to 500,000 lives in this country alone. Every year, we lose tens of thousands to opioids. I'm not trying to condemn medicine. I'm simply reminding us all that medicine and science are conducted by human beings who are fallible. We realize that we've made mistakes. Sometimes those are honest mistakes. Sometimes people in positions of power succumb to hubris. Sometimes they succumb to special interests and things like that. To make decisions that affect our lives on such a deep level, on the basis of that alone, doesn't make sense to me. When we look at the science, I'm sure that the people who are advising you all have plenty of science on their side, saying that mask mandates work. But there's plenty of science on the other side. Just yesterday, a study was published that showed that examined 3,000 people who wore masks all the time when they left the house, and 3,000 people who never wore masks. It was in Denmark. It was probably the first controlled study that's ever been done. And that controlled study showed that there was no difference between the two groups who wore masks all the time and didn't. Literally, it was 1.8% contracted COVID and 2.1% who contracted. That's not statistically significant. And the other study that was just done was on US Marines. Those US Marines, they had them on lockdown, quarantine, and restricted social distancing, as well as continuous mask wearing. The people who didn't, okay, but the people who didn't abide by any of those things in the test, they were less likely to get sick than the people who were in the test. Can I just ask one question? Do you know what the cycle threshold is on the test that St. Luke's is using? No. Do any of you know what the cycle threshold is? It's the number of times that a sample is
Excuse me,
taken.
ma'am, your time has expired.
Their time has expired, man. You'll have to, we can't, we're beyond what we're allowed. We've allowed 2 minutes and that's all. We want to get as many of the folks in can talk.
I understand. Can I just say one last thing, please, on the cycle threshold?
Your time is up.
St. Luke's is doing a cycle threshold for 37, and Dr. Fauci said that anything over 35 is garbage. It means that people are
Excuse
not.
me, your time has expired. Please exit the building, the room.
Next, please.
You're up, Linda.
My name is Tatiana Gray, and I live in Blaine County. I'll speak to that county since it seems to be steamrolling this effort at this board. The city of Haley enacted its face covering ordinance on July 1st this year, and most of Blaine County was soon to follow. Since then, the compliance with the face covering mandate in the county has been near 100%. Fear and social shaming are ever present once you drop over the Zimmerman Hill. We had an extremely busy tourist season in Blaine County this year, despite the virus. We also had all of our regular trades and labor coming to work from your counties. Then the weather changed, the tourist season was over, and not as many laborers were needed. One thing remained constant since July 1st, the mask mandate. According to coronavirus.idaho.gov right here, the number of Corona cases in Blaine County remained flat from July 1st till shortly after the Labor Day, when slack hit and the cold and flu season started. Our state's own data shows that there's absolutely no correlation between face rag mandates and the number of cases, none. The busy tourist season did not increase the cases. The busy landscaping season did not increase the cases. So what increased the cases? The cold and flu season, which apparently does not care about the mask mandates. Imagine if we all put blinders on and pretended that sun stopped rising and we all had to live in the darkness. That would not change the truth that the sun keeps on rising, which apparently, and all it would do is make us all look pretty stupid running around in blinders. These face covering orders are just like the blinders. And the truth is that the upper respiratory virus season is upon us, just like it's been happening for millennia. The face coverings do not change or affect this truth one bit. The people have spoken many times by now, asking our public servants to cease cramming these types of orders down their throats. Yet the push continues for the sole purpose of fatiguing us into compliance with these measures. I implore you not to let Blaine County bureaucrats and medicrats to bully you into betraying your own constituents. Do not let Blaine County's tyrannical dream become your county's worst nightmare.
Thank you. Thank you. We
Thank
appreciate your time.
Good afternoon. My name is Linda Michaels and I live in Twin Falls. I'm going to read my comments on the mask mandate. It's my feeling you are without authority to override the state's constitution, Article 1, Declaration of Rights. Public health employees and county commissioners do not make our laws. Our legislature makes our laws. Senate Resolution 101, line 44. Quote, the Senate reaffirms the right of all Idahoans to make health and safety decisions for themselves and their families, end quote. It is a violation of Idaho Code to order a mandate and a penalty. According to Title 39, Chapter 90, Health and Safety. Chapter 90 is also called the Idaho Health Freedom Act. Section 39-9003, Statement of Public Policy. The power to require or regulate a person's choice in the mode of securing healthcare services or to impose a penalty related thereto is not found in the Constitution of the United States of America and is therefore a power reserved to the people pursuant to the 9th Amendment and to the several states pursuant to the 10th Amendment. The state of Idaho hereby exercises its sovereign power to declare the public policy of the state of Idaho regarding the right of all persons residing in the state of Idaho in choosing the mode of securing healthcare services free from the imposition of penalties or the threat thereof by the federal government of the United States of America. Section 39-9003, number 2. It is hereby declared that the public policy of the state of Idaho, consistent with our constitutionally recognized inalienable rights of liberty, is that every person within the state of Idaho is and shall be free to choose or decline to choose any mode of securing healthcare services without penalty or threat of penalty by the federal government.
Our time is up.
Oh, I'm sorry, I didn't get to finish the second page.
That's fine.
Would you like a copy?
I think we've already seen that.
All right, thank you.
Thank you.
Hello, gentlemen. Hello, ladies. My name is Linda Zeinerbell, and I live in Twin Falls County. And I know you have seen my letter of notification we gave you guys last week. So I'm not going to go there. And I know that there's probably 100+ people out there that you're hearing a lot of the same things over and over again. So I'm going to touch on some numbers. And these are the total deaths in USA. Everything from suicide, car accidents, every death in the USA. So in 2018, there was 2,839,000 205. In 2019, there was 2,855,000. As of November 13th, there's only been 2,465,323. That is a total amount of debt. So even if we, a month and a half, we get up to the 2019 numbers, where are the numbers of COVID in there? Where we're not seeing a big influx of numbers. So either people are not dying of suicide, they're not dying of car accidents, and now we have just everybody's dying of COVID. So I just want to point that out, that and this is from CDC, you can look it up yourself. These are their numbers. So the numbers are not jiving, which leads to a lot of mistrust. That's the reason why people are showing up, is we're not really trusting what's going on. The other thing is, Dr. Davis, this is a question to you, being an OBGYN. Do you not give all the mothers prenatal vitamins and teach them how to best take care of themselves? Do you not teach them how to take care of their child and educate them on how their system works, what their body's going to do? Why have we not heard from our medical staff other ways of taking care of our immunity system? We always hear about masks. We hear about the hot water and washing your hands, which I would like to say last time I was using the restroom, there's no hot water here. So why are you not teaching people about their immune system? Why are we not hearing from St. Luke's about our immune systems, just masks?
Thank you very much.
Good afternoon, everyone. Thank you for the time to be able to speak and give you my thoughts. I'm not quite sure what we're doing.
We need your name and where you reside.
I am Tom Zeiderveld. I reside in Twin Falls, Idaho.
Thank you.
You know, I was walking around out here visiting with people. There is a lot of irate people. And we are just to the boiling point. We are tired of our representatives not representing us. And the fact that you want to force a mask mandate on us, I'm just getting tired of showing up to all these events to speak my mind. It's like, you guys don't want to hear, don't want to listen. But I'm telling you, the Great Depression was bad, but the worst part about it was the government tried to fix it and made it worse. And that's what we're doing here, okay? We're trying to put a Band-Aid on something. We can't run and hide from a virus. We're going to have to deal with viruses all the time. If we look at South Dakota or Sweden and look at their way they handled it, they just handled it head on. We can't sit there and try to hide from a virus. I'm just glad I don't have kids in school, because they would not be in school. I'd pull them out, and I would not allow them to be muzzled the whole time they're in school. This ridiculousness needs to end. We need to protect those that are vulnerable, but we don't need to muzzle all the healthy people. So that's my 2 cents.
Thank you.
Good afternoon. I'm Representative Christy Zito. Today I'm here as a citizen and also to represent some of the people in my district that are part of Falls County. I would like to point out that I understand that according to Idaho code, you do have the legal authority to enact the mandates and to impose fines and jail time. But I would also like to point out to you, as I'm sure you already know, that the Idaho Health Freedom Act makes it so that even though something is prescribed or diagnosed or whatever, the citizens of the state, in this state, have the right to exercise their constitutional right to not comply if they choose not to. That the state of Idaho believes that as citizens of the United States, that we have the right to choose our own health care treatment as we see fit for ourselves and our families. I would also like to point out that just because something is a law, that does not mean that it is moral. Just because it is legal does not mean that it is moral. The example I will use is that if you commit murder, if you are to shoot a pregnant woman and the woman and the child would die, you would be charged with a double homicide. Yet in the state of Idaho, we abort 1,500 preborn children every year. Murder is immoral and illegal, except in certain circumstances. It's still immoral. And so I would encourage you to please think very carefully about the steps that you may take here today. The citizens of this state and the citizens of this country are fully capable of making their own health choices and decisions. It is not our place to impose upon them something that you would not allow your neighbor to walk across the street and impose on you. You have been delegated an authority. You have been given the authority that I, as a citizen, and every citizen in this state have to act in our stand only when necessary. The statistics aren't there. The numbers of death aren't there. We have conflicting information. I am on a conference call weekly with researchers from around the world and doctors. And the proof and the statistics just are not there that the actions and steps you're going to take will help. Thank you for your time.
Thank you. Okay, Alyssa, you're up.
Thank you, Representative. Allowing us to speak. I'm going to be speaking a short speech from my top pathologist. The name of Dr. Oh, sorry. My name is Chris Armstead. I live in Twin Falls.
Thank you.
All right. I'm reading a brief speech from top pathologist Dr. Roger Hodkinson, and he received his general medical degree from Cambridge University in the UK, MA, MD, B in chiropractic, where he was a scholar at Corpus Christi College. Following a residency in the University of British Columbia, he became Royal College Certified Pathologist, FRCPC, and also a fellow college pathologist, PAP. He is in good standing with the college.
Well, I'm
Now, Hodkinson's comments were made during a discussion involving the Community and Public Services Committee, and a clip was subsequently uploaded to YouTube. Noting that he was also an expert in virology, Hodkinson pointed out that his role as CEO of a biotech company that manufactures COVID tests means I might know a little bit about all this. There is utterly unfounded public hysteria driven by the media, politicians. It's outrageous. This is the greatest hoax ever perpetrated on an unsuspecting public, said Dr. Hodkinson. The doctor said that nothing could be done to stop spreading the virus besides protecting older, more vulnerable people, and that the whole situation represented politics playing medicine, and that's a very dangerous game. Hopkins remarks that social distancing is useless because COVID is spread by aerosols which travel 30 meters or more or so before landing, as he calls for society to be reopened immediately to prevent the debilitating damage being done by cars. All right, thank you.
Thank you for your time.
All right.
Okay. My name is Elisa Atkinson and I live out in Fort Idaho. And I'm really thankful for the opportunity to come and speak today. I really appreciate the way you guys set this up to give us a voice. Thank you for that. I wanted to share a couple of concerns. I've spent several hours looking over your drafts and proposals. And the first concern that I have is I don't think these are necessary at this time. I'm a part of a parent organization in Fuel. And when we first started our organization, our goal was to get rid of the mask mandate in our school. And over the last couple months, I've seen the community shift in these opinions. People who 6 weeks ago felt adamantly that we needed no masks are now arguing adamantly that we need masks. And so I wanted to say you guys have done a great job. I don't think, however, that these policies are in particularly going to impact the amount of people wearing masks in our communities at this time in public spaces. What they're doing in their homes is probably different from public spaces. I just don't think it's gonna change anything, and that's after reading over the guidelines many times. My second concern is that sections 2A and section 3 are really concerning to me. As a mother, I really used to say that I am personally responsible to make sure that my children wear masks in public at all times. And if I don't, I could be criminally liable for misdemeanor charges. This means that if my 6-year-old goes to school and doesn't want to wear a mask, I could be charged with a misdemeanor. If my 16-year-old goes to work and takes off his mask, I could be charged with a misdemeanor. I recognize that it's not the intent of the board to criminally prosecute parents for the misbehavior of their children. And you could easily argue that it would be highly unlikely that this would happen. That is probably true. But your policy is written in a way that could allow for this. Good intentions do not create good policy. Good policies wisely chosen inspire penalties. With wisely chosen penalties inspire trust, but good intentioned policies with poorly chosen penalties promote fear and anger. In the coming months, with the vaccine becoming available and a population that is deeply skeptical of the safety of this vaccine, I'm concerned that it's really important that our communities trust the Board of Health. Thanks, you guys.
Thank you.
Hi, my name is Raquel Belknap. I live here in Twin Falls. Early when COVID started, I'm kind of a science junkie. I love studies. I read more studies than my doctor has in the last 15 years. And I was reading, I was keeping up with the science, and I was paying attention to math, and I found myself in a conversation with an explosive ordnance disposal expert, trained very extensively in biologicals. And I brought up masking, and he said, "Oh, leave it." I said, "Why?" Because the very first thing they teach us on day one of biological training in my training is masks are 100% useless. They do virtually nothing. So I went down the rabbit hole and I read all the mass studies, all of the random controlled trials, every single one of them. There is not one that shows that masks are effective. They all show that they do nothing to slow the spread of respiratory illness. And if you look at the charts, if you put every chart of every community masking with mask mandates, whether they have them, whether they don't, next to each other, what you will see is a cycle, and that cycle remains exactly the same. The only thing that's different with each community is when the mask mandate was put in. The cycle remains the same, including Georgia and places that have zero mandates, places that have very well compliance have a lot. But I'm concerned about the absurdity and the suppression of information, that we double down. There is so much information out there that this really isn't working, and we keep doubling down on it and suppressing that information. And we're suppressing the doctors who are successfully keeping their patients out of the hospital by treating early. And instead of having us worry about mask mandates, why don't we start looking at the doctors that are actually being successful, that have thousands of patients and almost no hospitalization and no deaths? But we ignore them and we take their information down, and we keep doubling down on this, and the science doesn't back it up.
Thank you.
That right?
Thank you. Thank you.
Hey, Bill. Wow, Johnstone, Jerome County. Unfortunately, we find ourselves in another one of these meetings. So I want to take us back to the foundation of the nation. Declaration of Independence, the Articles of Confederacy, Constitution of the United States, Constitution of the State of Idaho. Constitution very clearly, if you've read the Constitution of Idaho, says you're not the legislature, you don't get to make law. Okay, so we'll start there. Not happy about this. UK COVID-19 cases in July of 2020, they required masks. Guess what? Their spike looks like our spike. Austria, COVID-19 cases, mask requirements in May. October, November, cases spike. Kansas City, Missouri region, 629 mask mandate. Guess what? October, November. Now we're minute 53. We got 3 minutes? 2 minutes. Okay. Mask mandate. We spike. Guess what? Ada County, July 2nd, we put in a mask mandate. Spike just looks like Twin Falls. The reality of this thing, people, have you ever heard of the World Economic Forum? You ought to go there and do a little research. COVID-19 is the tool to take over world government and to basically to transfer major amounts of wealth. COVID is a joke, wearing masks are a joke. I mean, that's personal preference, but you don't have the right to tell anybody to wear a mask. A doctor can write you a prescription, but he cannot make you take it. Thank you.
Thank you. So I'm Ray Walt, I live here in Twin Falls. I'm sure you've heard a lot of reasons for not mandating masks. I'm not gonna get into repeating those. What I am gonna do is tell you, I was a small business owner here in Twin Falls for 38 years. I know what it takes to start a business, grow a business, and maintain a business. This mandate is not going to help for small businesses. I'm not in this anymore. I'm retired, but I can tell you that the mask mandate will hurt our local communities. Another thing I would say, I think you guys all want to do something productive, help our communities. I hope you do. Where are the remedies? Why can we not? If I went to my doctor today and said, I want a prescription for hydroxychloroquine because I believe it'll help me get through this to prevent the virus or help me get through the virus, guess what? I can't get one in the state of Idaho because it's in banned. We've had doctors come down to the city here a week or so back and tell us hydroxychloroquine absolutely works. She was a doctor here in Idaho, but she says, guess what? I cannot prescribe it. So if you want to help, look at some of that stuff. The other thing I would say, what we've done during this epidemic to our senior citizens is criminal. There has got to be a way that family members and friends can visit those seniors in these homes. I think if you even polled the seniors themselves and said, if we let your family and friends come in, you're at risk, they would say, I still want to see them. We just passed through summer and these people couldn't see their friends and family. They could have met outdoors. Even today, there's places, most of these homes have big rooms that families could meet in. So I would say that, look at that, look at remedies. The other thing, I do not believe that our children should be going to school, and I don't have any kids in school, but I do have grandkids in school. And look at some of those things that you can do that would be positive for our community. Thank you.
Board members, I have 2 points today, and I'll keep them brief and direct. First, on health and welfare. Oh, yes, yeah, Riker Herndon and first on healthandwelfare.idaho.gov. Stated goal of this board is community health nursing and home health nursing to environmental health, dental hygiene, and nutrition. If this is your goal, then a mask mandate will fail to achieve it. The death rate of COVID-19 in Idaho is 0.94%. If this mandate passes, you will force people to expose their private medical information in order to identify themselves as exempt to anyone and everyone who asks why they aren't wearing a mask. Rape victims and victims of physical abuse who often cannot wear masks due to the trauma they have faced would be forced to relive their painful experiences. Perhaps most disturbing of all, this will set a dangerous precedent for removing the rights of citizens in order to accommodate the vast minority. If your goal is health-oriented, this mandate does not accomplish it. Second, in this mandate, you state it is the overall desire and request of the Board of Health, South Central Public Health District, that law enforcement educate the public about this order and its purpose. If that is true, then your enforcement choices were poorly made. How exactly will a $300 fine or 6 months in jail educate the public? How will making the choice not to wear a piece of ineffective clothing a misdemeanor offense get you closer to that desire? How will falsely imprisoning Idahoans educate anybody about anything? In closing, I'd like to ask you a question. What happens when this mandate doesn't slow down or stop the spread of the virus? What rights will you infringe next? If you pass this mandate, you'll be well on your way down the slippery slope of tyranny. I assume that you took these positions because you genuinely care about Idahoans. Please listen to us and get on with the good work of helping Idahoans. I advise you to turn to God and pray for his guidance.
Thank you.
Happy to this day. My name is Shanti. I'm from Twin Falls. I'm just going to read this so I won't lose track of this day. The data is in. Masks do not work to stop the spread of SARS-CoV-2. To say the medical field is in agreement that masks work is not true. There is no evidence. The data shows them to have no positive effect. It does not matter how loudly the CDC, the WHO, and other head-ups in the medical field say otherwise. I would like to respectfully mention that doctors are just people who are always discovering and learning more about how our bodies work. This is not a criticism. I am really grateful for doctors when I need them to fix a wound. But to blindly follow the medical field and the medical field themselves without following the data is foolish. Let's remember a time when doctors recommended cigarettes to treat anxiety. Doctors prescribed thalidomide during pregnancy, which causes birth defects. There are a few other things that were supposed to keep us healthy, like lobotomies, heroin for cops, bloodletting, drinking radiant water, gasoline for treating lice, morphine for teething, and mercury for syphilis. Fortunately, we know now about masks' effectiveness because we've had 8 months of lockdowns to observe, and this observation is invaluable. They don't work. If you pass the mandate, as health professionals, you will have joined the ranks of well-intentioned but mistaken medical professionals of the past who promoted cures and procedures which time has shown to be ineffective or even harmful. Please follow the real science and vote no. On a really quick personal note, I have a few more seconds. I'm living, and I want to share
Am I doing that?
Sorry.
I probably are too far. Well, I'll just end mine and call back in a minute. I'll just call you back in a minute.
She's muted.
Okay, move on.
Okay, thank you. I just want to share my personal experience. I'm medically unable to wear a mask, and myself and my children have been cussed at and threatened, told to go by people who they don't understand that there's many more groups than just masks and masks. So they make assumptions. I had a gentleman at Costco say, "I'm a doctor. You look healthy to me, sweetheart." And like it was very uncomfortable. Everyone was staring. Anyway, this happens all the time, and it's becoming more threatening one day. So please take that into consideration as well. Thank you so much for your time. We appreciate you being there and listening to us.
Thank you.
Thank you.
All right, you're up.
When I got this mandate, I read it. And one of your whereas clauses, you say International Health Regulations Emergency Committee declared the pandemic emergency. That means lawyers. Dr. Tedros didn't declare it until March 11th, 2020. So what that tells me is that this is an international law emergency. They are trying to assert international law on the people of Idaho. Now, you people, district health people, according to Idaho law, you are a nebulous thing called a governmental entity. You're not part of the state. You are separate. We don't know what you are. But what we do know is that you are not accountable to the people of Idaho. We don't vote for you. We wouldn't even know that you're out there. unless, except for this mandate thing. And since you included this international health regulations thing, that tells me that you are dancing to the tune at a different level, the international level, not domestic. As far as I'm concerned, you guys might as well be wearing blue helmets. You're not part of the state of Idaho. And but you're trying to pass this mandate under the Emergency Act. And it was Hitler who came to power, the emergency provisions after the Reichstag fire. And that's what they're trying to do here, is to institute international law. And you can look at the Border 21 program that was for the North American Union, where they were merging functions of government, because under environmental health, that's where this started. Anyway, thank you.
Thank you.
I just want,
Please state your name.
Oh, okay, I didn't realize. I'm Jerry Helm from Twin Falls County. Or from Twin Falls, I guess. And I just want to kind of say, I mean, you're wanting to mandate something that doesn't guarantee that I'm not going to get the virus. I mean, me wearing a mask is not a guarantee that I'm not going to get the virus. So since I feel like I live in a free country and I was given free will by the Lord above, that I should have the choice to wear that or not wear that. And there's several studies that have been put out recently that show that wearing a mask or not wearing a mask, if it's not worn properly, and 99% of us civilians aren't going to wear them properly because we're not in the medical field. That it's not going to protect us any more than if we don't wear one. So I feel like I should have that choice. If I want to protect myself from it, from getting it, then I should have the choice to wear it and not have it mandated and have me be penalized if I choose not to wear it. So that's all I have to say.
Thank you.
Thank you.
Ready?
Marcia Hart, Blaine County. And the first thing I want to talk about is how we manufacture truth these days. We're in a society that manufactures it by saying something over and over, whether it's true or not, until everyone believes it's true because they've heard it so many times. And your job is to know the difference. Not an easy job. I make mistakes a lot. And the conclusion I come to often is none of us are informed enough to really know the truth. However, what's legal, what's not is a little different. There's substantial evidence showing that masks are harmful. There's no good evidence statistically showing that masks effectively prevent the spread of COVID or any other virus. There is a lot of evidence from studies of how oxygen deprivation, overload of carbon dioxide, toxification by breathing your own toxins back in, and allowing them to incubate in your mask are problems with wearing a mask all the time. For me, it's unethical, unconstitutional to force healthy citizens to abide by measures that can result in physical, emotional harm that impinge on their ability to move freely throughout society without discrimination. Measures that are meant to protect the community as a whole are ineffective as they hurt individuals in that community. It has to be a decision to wear a mask as a personal decision, not because it's mandated. Thank you for your attention.
Thank you.
Hello. I'm going to read from this because we have so little time this week. And by the way, their sound system out there is very difficult for people that are very close to that computer to be able to hear. Quite impossible. In the shorter term, I have nothing against wearing a mask, and I would tend to follow such administrative and decisions and restrictions primarily in order to be able to converse with others face to face and attempt to better define the depth of the problem in its entirety and search for alternative solutions than merely wearing a mask and maintaining social distance. In the longer term, we all need to understand there are bigger problems at play, and limiting our responses to the mask and distance issue is not going to help much. By the way, my name is Dan Henry. I'm from Blaine County, and I understand that Angie McCleary is listening in on Zoom. She will probably recognize me. Is she seeing this on camera? Yes. From the redundant power line open hearing of a month or so ago. The much bigger picture. International geopolitical developments directly affect the rollout of both, thank you, the coronavirus 19 pandemic and associated mitigations efforts. This has become a total numbers game, and with absolutely everything possible dealing with our individual and collective futures at stake, it's high time for questions about recounting not just presidential election results, but all statistics regarding caseloads and overwhelmed hospitals and deaths with and or without comorbidities, and for the same to be related to select counties in specific with complete transparency as regards the methods and means being utilized in collection of the same. We, the people, are much more concerned, especially at this juncture in history. The entire country, if not perhaps red state Idaho, has been completely politicized, and we are all amazed at just how much has been going on behind our veritable backs in Washington, D.C. and separate state capitals. Fact of the matter is, when the deep state openly acknowledges not only its actual existence, but unabashedly praises and postures itself as the real savior of the American democracy and way of life, said individuals are provided backing, and said individuals are provided backing by the mainstream media, then the times are demanding that every person. Thank you very much. Here is a copy of that Danish study. It was just published in medical journals. Here is a copy of an op-ed from The Hill, which relates this pandemic with, and here, so that we know, these are the clinical other things, and I do collect every day since March the data that comes out. So I would like to recommend that you have workshops. Talk to Eric Myers. You guys should have workshops in each county. I'll come. Got a lot of data.
Thank you.
Good afternoon. My name is Pamela Fadness, and I'm a resident here in Twin Falls. I'm a wife, mother of 5 kids, business owner, and a concerned member of our community. And I'd just like to, I felt it was really important for me to come. I've never done this before, but I felt it was very important for me to come today to share my opinion and my perspective. So I'd like to just ask you 5 questions this morning for you to consider. So first, my first question is, how many of you have had the virus? How many of you have had the virus? I have had it run through my family. I have many kids. We had it run through our family. We have quarantined 4 times, and we wear masks. We wear masks where they are required. We wear them when we're out in public. We do the social distancing, so we're following those guidelines. We still got it. I'm happy to say that we're all fine. We made it through it. Everybody's recovered. We've been okay. It's been different for each person. I have many, many friends who have had it. We are very involved in a large church. I have many, many friends there who have it. And we've made it. We're okay. The second question is, are you willing to overstep your bounds and your rights? Because that's a scary place to be. There's going to be wasted time and money because there will be people who are going to file lawsuits. I'm certain of it. I've heard about it, people talking about it in the community. So that is to come. There is litigation. And then the other thing is we will remember. For people who are voted into positions, we will remember when it's full time. The third one is, will this cause greater harm to our communities? I believe yes. I listened to a professional this morning who said yes, it will. Fourth, how will you enforce this? How in the world will you possibly enforce this? I believe the ways people have to do this are going to inflict more disunity in our communities and cause more problems. And it's going to create just a lot of people pitting each other against one another. And then the fifth one is, can you guarantee us that this will protect our community? Can you guarantee us that this will? I said we've been wearing it It has not, and I believe that the answer has to be no. You cannot guarantee that this will do anything to protect us. I would like to just finally say, why don't we focus on another solution? Why don't we do some things that will protect those who are have greater risk? Let's instill some things that will help them, more deliveries, things like that.
Thank you, ma'am.
Thank you.
Thank you. I'm going to invite the county commission here, but move guys to the next step. So I want to thank you for taking comments on this. Again, what I was going to tell the county commission is no one voted on you guys, South Central Idaho, to mandate anything.
We need your name.
Bill Chansky, 2205 South, 1800 East Gooding, Idaho.
Thank you.
And but nobody, like any custody, I've seen in CSI do recommend this. Nobody agreed on any of this, but I do agree on what the county commission did with Elko County. They went and start talking about putting laws out. They told them, when you guys are voting in the marijuana place, it affects us. What the county commissioners are doing, they're not okay. But one, it's a federal law. There's a federal law against that. We've got a bunch of idiots in office now don't want to do that. But anyway, so when you do that, you're doing the same thing. You write a letter, as the county commissioners did about accepting refugees. Again, it affects our county too. What goes on in Cliff Falls affects Gooding and all these other counties. What I'm trying to say is, we are the United States of America, not Maverick States of America, not Maverick Counties of America. It's time we get back together. And I just look at it that way is, so whatever they do, otherwise we need the job. The Elko disregarded the federal law about that. If we're in doubt about any laws or anything like that, or does the federal law require it? Let's start going legally down the line. We're undermining what the federal law is looking at. I'm like this lady here, she said, by mandating this law, you're putting our law enforcement personnel in jeopardy. If you require a mandate there, the poor guy's got to enforce it, and all it takes is one unstable individual to start shooting them. And I don't want to see that. Thank you for listening. And you just no to that mandate. Thank you, guys.
Go ahead. Good afternoon. My name is Cesar Swallow. I live here in Twin Falls. This owner. Like you said, I think that, we're going to dump a huge burden onto our law enforcement imposing this. Not a lot of people are going to want to comply with it, but it's going to put them in unnecessary danger. And, it's going to cause a lot of, separation within the community itself. People are going to draw lines, and it's going to cause chaos. But the other thing I want to bring up is some of these numbers. The reason I have an issue with some of these numbers is because there's a financial incentive behind the COVID. So if there was an independent audit of St. Luke's, as far as what are these things getting COVID? What kind of treatment are we using? What are we doing? They're pushing this masking, but they're not saying, hey, we need to get healthy, we need to exercise, we need to, there's nothing. It's just cover up and be afraid. I don't think that's a good job. One thing, okay. Like I said, I think there needs to be an independent audit of the numbers from St. Now within St. Luke's. I mean, it's a business. These people, if you think the hospital's your friend, go there without insurance to the emergency room and see how much help you get. I guarantee you're going to go there leaving bankrupt if you have any kind of major issue. They're not your friend. They're not here to help you. They are if you get sick. Yeah, I understand. But at this last meeting, that chief of police, he had his number ready to go because they're already overrun. Their dispatch, they run the fire, they run the ambulances out of there, they run the police out of there. So with all those three things coming through one dispatch unit, what really needs to happen is they need to get another station where they can dispatch. Because he did everything but say, thanks guys. Thank you for your time.
I think, Bob.
That's the last one.
Okay. My name is Annie Williams. I live in Rupert. I came here today to speak against the mask mandate. If you take the emotional aspect and or the fear-mongering atmosphere created by the media, take a look at the actual numbers, there's no solid reason to mandate this. Those current numbers published today, this virus has an average survival rate of 99.13% in Idaho. By the numbers, I have a better chance of dying from heart disease, cancer, chronic lower respiratory disease, suicide, opioid overdose, motor vehicle crash, a fall, a gun assault, a pedestrian accident, a motorcycle wreck, drowning, fire, or smoke inhalation. And I have a better odds of my house being struck by lightning. As for the argument that it is to protect those that are immunocompromised, my own daughter in 2001 was diagnosed with cancer at 8 years old. At that time, I knew it was my responsibility to protect her. It wasn't the school's responsibility. It wasn't the police responsibility. It wasn't the store's responsibility. And it definitely wasn't the responsibility of strangers that I had never met. I do not know. I've heard arguments that our hospitals are short-staffed due to employers being sick with COVID. Do they not wear masks? Do they not wash their hands? Do they not take precautions already? If masks were truly the answer, they would not be sick and be short-staffed due to COVID. And to add on a $300 fine, so many people have already lost their jobs, their businesses, and entire industries have been shut down because of this, and due to the fear-mongering and extreme overreach of multiple extreme governments. It's a sad day in the United States to think that I could be put into the same as domestic violence, drunk driving, and possession of drugs just because I choose to follow actual numbers and not wear a mask. And my opinion, to exclude this many people that are here to voice their opinion in the United States is sad. Every voice deserves to be heard and should be heard, and this board is not allowing these voices to be heard today. Thank you.
Thank you for your time.
Thank you.
Hi, thank you guys so much for hearing me. I'm the last one, so I'm supposed to make it big, right? My name is Erin Wilkins. I've been a nurse for 20 years, and I run my own practice called the Healing Center here in Twin Falls, Idaho. I work with a lot of my clients coming in sick with allergies. I know that the main, your guys' slogan is to prevent and promote and protect. And I would love to see funds and allocations going towards actual protecting, helping people learn how to build their immune systems up. I believe that the mask is a petri dish on the face, and I would love to see how people can build their immune systems up so that any diseases that come along, they're able to physically fight off within themselves rather than just trying to prevent something from happening to them. I think I would love to see just monetary resources filtered that way towards protecting the public instead of just preventing something, because we're all going to get sick at one point, but we can fight that off within us. So thank you so much for hearing me. Appreciate it.
Thank you.
Thank you. That being the last one, on the comments that you've been handed from outside, we will.
We lost you.
Let's read for the last 2 minutes of this public input time, some of the comments that have been left with us on paper.
These are the public comments. Is that yes, and 4, and I'm gonna look at the rest of the public comments.
One. That's what that was for. Yeah. Okay. I was just the timer.
Oh. Oh, yeah, you can say that there. He's leaving.
Does someone want to read a couple of the comments on the 4 masking mandate side?
Yeah, Linda on the screen up there.
Yes.
I'll switch over there.
Thank you.
Everybody got on the board?
Brent? Brent? That nice policeman told me I ran that stop sign.
Okay, our 90-minute public input time has ended. I will call the meeting back into order for the Board of Health. I remind everyone that this is a public health board meeting. So at this time, we will turn it back to the board, and I will ask comments from the board members that are on Zoom or the phone to comment first. We will go down alphabetically. Blaine County.
This is Anjani McCleary, Blaine County Commissioner and Representative. I appreciate the public comments that we received today in the hearing and the many that we received via email. I think the board is aware. We've also heard from the hospitals about the grave situation that we're in right now. We have some of the highest cases of COVID in the state and in the nation, and I believe that something does need to be done. I think that there's a lot of misinformation. If you look at the scientific information, there's significant evidence that wearing face coverings helps protect those around you from getting sick. If you're sick, I believe it's an important public health measure, and I believe it's our responsibility as a public health district to mandate this. The governor has said repeatedly, even when we've asked him to do so, that it really is the responsibility of this board, and I hope that this board will take that action today. I'm prepared to do so.
Thank you. Camas County. Pam?
Hi, I'm Pam Jones from Camas County, and I really do appreciate all those who have written in comments and all those who spoke today. I hear your concerns. I also hear the concerns of our healthcare workers, and I know that we're in desperate times and we need desperate measures. I also hear the concerns about the penalties, and those are concerns I share with you and would like to discuss more. Thank you.
Thank you. Cassia County, Bob?
I listened to the people.
Bob, could you drop your mask off?
I listened to the people who gave their afternoon of time, came in. I personally have felt that masks don't do anything for us. Maybe if they were properly worn, but I don't think that the masks are going to solve our problem. Part of our problem, we test thousands more people every day, and we find thousands more positive cases. Now, if they won't tell us how many we test nationwide, we don't even know what the true percentages are. I'm of the belief that due to the fact our hospitals, we're overloaded in our hospital because we only have 3 rooms that are allowed for COVID in the Rupert Hospital. We don't know about all the other hospitals, but I decided how I'm going to handle this.
Gooding County, Helen?
Yes, this is Helen. And my biggest concern is the overload on the hospitals. But I will hold my vote until such time as we take that up. Thank you.
Thank you. Lincoln County, Roy?
I vote no.
We're not voting, Roy. We just want your comments.
Yeah, all you do is just tell us what you think.
Oh, okay. I'll go. I've done a lot of research, called doctors, nurses, hospitals, and you get different answers for at different times. I had one person that mentioned we need to persuade. And a lot of you are probably not old enough to remember the song Friendly Persuasion. I would like to emphasize friendly persuasion rather than force.
Okay, thank you. Minidoka County, Tracy?
Yes, this is Tracy. And again, I want to thank the public for their input. I know we didn't get a chance to hear from everybody that was at the office today, but many of us have received several emails and phone calls from those who wanted to have a say in this. And so I do appreciate, especially those who have been respectful and dignified. As a Board of Health member, I do not take this lightly at all. It's been a task given to me by the Idaho legislator that says, do all things required for the preservation and protection of the public health. We've been in this pandemic now for several months. We've continued to see an increase in the positivity rates and the death toll from the virus. We as a board have heard from several healthcare professionals over the past several months regarding the hospitals being stretched to their max and staff shortages also. We as a Board of Health, we need to do something. We need to take a stand. We've tried the education route. We've tried suggesting that individuals take personal responsibility. We've strongly suggested the wearing of face coverings, yet nothing has worked. We need to step up. We need to be a part of the solution, not a part of the problem. And my decision today, when we vote, will be based on facts and science. I too have read many things about this virus, and I've tried to decide what is scientific and what is opinion. So, and it's not about rights or liberties, it's about public health. Thank you.
Okay, thank you. Twin Falls County, Commissioner Riemke.
Thank you, Madam Chairman. I'd like to also thank all those that came to participate. Last week when we had our meeting, I made a motion to allow us to hear from the public, and this is what we've been hearing for quite some time here in Twin Falls. And it's a slippery slope from my perspective. I can't separate the medical side from the individual liberty side, because when you look at the challenge we're going to be facing if we were to pass this, we are going to have people that are going to deliberately violate this situation, this order. And then we're going to be facing penalties, or we're going to be facing jail time. And I think it's counterproductive. I think it's a very, very, very dangerous slippery slope. I think we're pitting our people, especially here in my county, against each other. And I just can't stand for that. We need to find ways to continue this effort of education, not mandating. It is a liberty issue, whether we want to look at it that way or not. In my opinion, it is, and I think it's something that we need to take to heart. People are the amount of fatigue, COVID fatigue that's here is serious. There's no question about that. But I think we need to be very mindful of the authority and the power that we possess this afternoon. And we need to be very careful as we move forward, whichever direction it may be, because people need to trust this Board of Health. This effort in Twin Falls County and all 8 of our counties is really important. And we do some incredible work on a day in, day out basis. That's our staff do. And if we vote one way, they get a message, the frontline workers get a message. If you vote another way, then there's another message to be sent. I'm concerned about that. I can tell you that at this point, it is a liberty issue for Twin Falls County. It is a concern about $300 and possibility of 6 months in jail. I got 50 people on the floor today in our county jail. We don't have enough space. So it's a serious concern for Twin Falls County.
Thank you. Dr. Davis, our medical consultant.
I appreciate the input from the public today, and I don't have any other comment at this time.
Okay, thank you. On behalf of Jerome County, I definitely appreciate the manner in which the people came to testify and participate in our meeting has expressed. It's very important. Our staff has worked many long hours working with this, our tracers, our investigators, and this type of thing. I do want to remind everyone that the resolution that was passed in July by the Board of Health is still in force. So we are still strongly recommending. And as you are aware, we asked the governor to issue a state mandate. We have not had a response from his office. And I assume that he is going to go ahead with his press conference on Friday. There are many issues here, and that is the protection of others. We're told, and according to the messages in the chat room, the masks are to protect others. And yes, you have the option, but we also, and just for clarification, the amount of fine and such is in policy. And so our option for reducing or eliminating that is not eligible. So at this time, are there any other discussions from the board members?
Madam Chairman, may I just add one more comment?
Yes,
Go
right ahead.
Thank you very much. As I said, I've spent hours and hours and hours researching this, had many phone calls, and there are so many businesses. We are probably the smallest county, agriculture county, and it's impossible for these businesses to function with masks. I give you just a couple of examples. The dairy people. There's no way that they can sprinkle cows, wash cows without getting their masks wet. They cannot function that way. I've had many of them call me and say this. Our excavators that have to work in the trenches. We have those in our county. They said we cannot wear masks in the trenches over 5 minutes before we pass out. And so they cannot wear them. These are all things that, yes, we can make exceptions to those, but pretty soon we make all these exceptions and it's the same as not having a mandate. Thank you.
Thank you. Are there any additional comments from the members of the board? Hearing none.
This is Pam. This is Pam.
Go right ahead.
Yeah, from Camas County. If this mandate does pass, I do think that we need to increase our efforts to educate in a different way, and to invite also, as well as mandate participation from the counties. And because our county is a little ways out of the way up there, maybe we don't see as much of the education that you see down there, but maybe we can support our mayors and our commissioners and provide material that can be seen in the counties easily, either posters or things that would encourage us to do more, because I agree that masks aren't the only answer. It takes everything. It does take keeping up our immune systems. It takes distancing. And it is all about caring for those around us. I just think, like Mr. Renke, that we need to reach out and let the people know that we're working for them, all of them, not just one portion or the other, and that we are trying to save our medical resources so that all of us can access it in the future months. Thank you.
Madam
Thank you.
Chair.
Any other further comments from the board?
Yes, Madam Chairman, this is Brent from Twin Falls County.
Go right ahead.
I'd like to make a motion, and I do not want to send a message to our frontline staff, our medical staff, our friends and our neighbors that they're not important to us. Because they are. The work that, as I mentioned a moment ago, we do here in public health is critically important, and the work that's happening in our hospitals and our healthcare frontline team is essential. But I would move that on Public Health Order 2020 1.12.2020, so it's 11/12/2020, A and B to the table. I would like to table both of these public orders that we're looking at today and leave them there.
I would second.
You want to table them indefinitely?
Yes.
Thank you. Is that a friendly amendment?
Yes.
Thank you. Is there a second to Commissioner Renke's motion?
Seconded. Commissioner Carroll.
It's been moved by Brent Renke and seconded by Kanu. And Yvonne, would you read the motion back, please, in its entirety?
Yes, so it was moved by Commissioner Brent Renke and seconded by Commissioner Bob Kuna to move on. The motion was made to table the Public Health Order 2020 11 and 12 A and B indefinitely.
Any discussion on the motion is read?
This is Pam, Madam Chairman. I just would like to ask what you mean by indefinitely. I think that we have to look at it at some time and either discuss alternatives or a better way, but I don't understand the indefinitely.
Commissioner Renke, would you answer that question, please?
I think if we do consider it, it would be a new document, it would be a new approach, it'd be something that we and the public could view, and you would have public comment on the next effort as well.
Thank you. Does that clarify your question, Pam?
Kind of.
And
any other further comments? Anjani?
yeah, this is Anjani. I feel really strongly that this is a very bad direction for our board to go in. I think I hear you, Commissioner Renke, that you don't want to send a message to our hospitals, but that's exactly what we're doing with this if we pass this motion. We've heard very, very clearly from the medical community what they want us to do to protect the health and safety of our community. So to not take that action, I think is really a mistake.
Are there any other comments from the board?
Chair,
Yes,
this is
Tracy?
Tracy. Yes, I am also against the tabling of this. Again, I understand that we have a lot to consider here, and it seems like it's been a short time, but we know as a board that we have been discussing this for months, and I believe today an action needs to be taken, and we need to listen to those comments from the public, which we have done. We have also heard from medical staff in all of our local hospitals, and so we understand the dire situation they're in. So this tabling, I don't quite understand that either, and I think we need to take action today.
Are there any further comments from the board? Anjani?
Yeah, I mean, I almost think that it would be better to have a motion. I mean, is this the intention of the motion to deny this? Because if that's the intention, then we should just be transparent, and it seems to me that that would be more appropriate.
Any further discussion? Any of those in favor of the motion to allow equal time? Hearing none, I call for the vote. Yvonne, would you call the roll, please? And before you do, would you reread the motion in its entirety?
Okay. The motion was made by Commissioner Brent Ranke and seconded by Commissioner Bob Kuna to table the Public Health Order 2020-11 and 12 A and B indefinitely. Blaine County?
Nay.
Please call the roll.
Camas County?
Nay.
Betcha County?
Yes.
Gooding County?
Nay.
I'm sorry, Helen, what was that?
Nay.
Thank you. Jerome County?
Yes.
Lincoln County?
Yes.
Minidoka County?
Nay.
Twin Falls County?
Yes.
Medical Consultant?
Nay.
Miss Blaine County.
Oh, I had already said Blaine County. You
Yeah,
voted
I was first, Linda.
Okay, sorry, what was your vote?
Nay.
nay.
Thank you. Yvonne, what is the count, please?
Five to four for the nays.
Motion goes down in defeat. Is there a second motion to be placed before the board?
I would make a motion, Bob Kuno, I would make a motion at this time that we do not adopt a mask mandate today until we have a little further time to find out how the vaccines work. I would say we table it for 1 month till, well, mid-January. At that point, we can reassemble. If we haven't got anything further on the vaccine, I would open for discussion again.
I would second that motion.
Okay, Bob, would you clarify your motion with a little fewer words, just the exact details, please, as to what you're wanting to do? You're wanting to table it for 1 month and then bring it back for consideration? Could you clarify that, please?
We'll table both of them until our meeting date in January for evaluation between now and then to determine what happens with the virus vaccine.
And the second to that motion was Commissioner Ranke, correct?
Yes.
Okay, Yvonne, would you read the motion back, please?
Okay, just a minute. Okay, so it was moved by Commissioner Bob Kuna and seconded by Commissioner Brent Ranke to table both public health orders until the January Board of Health meeting. And I didn't catch the end of that, Bob.
That's the time.
Okay.
And it'll be available for review at that time.
Okay.
Discussion at that meeting.
Any comments from the board?
Madam Chair, this is Tracy.
Yes, go ahead, please.
I'm going to say the same thing that I said on Commissioner Reinke's motion is I don't believe we need to be tabling this today. We need to make a decision, a yes or a no decision today. And whichever way we go as a board, we need to decide that today.
Thank you. Any further comment from the board?
Yeah, I would comment that we've heard from both St. Luke's, Azanjani, and St. Al's that they will be in critical standards by December. And I think now is the time to take action. We've heard from the public. We understand the pros and cons, and we should take action. I agree with Tracy. One way or another, we need to take action today.
Thank you. Any other comment from the board?
Madam Chairman,
Where's your own? Go right ahead, Brent.
one of the concerns that I would have is the impact it's going to have on my county with the enforcement of such an order. The healthcare system is overrun. Well, the criminal justice system will now be overrun if we move ahead on this, because we are going to have a division with people. And I would strongly oppose anything but tabling this particular act because of the challenge we have. And we're far enough down the road where I think the unintended consequences are going to be very severe.
Thank you. Any other comments from the board? Hearing none, I agree that we need to either put a mandate in place or not put a mandate in place. There's nothing that can prevent us from reviewing it at our meeting to see if it works or whatever. I agree with Commissioner Renke about the mandate affecting law enforcement, neighbors against neighbors, and this type of thing. So if you are in favor of tabling it, you will vote yes. If you oppose tabling it, you will vote no. Any further discussion? Hearing none, Dr. Davis, did you have a comment?
No.
Thank you. Yvonne, would you reread the motion and make a roll call vote, please? Remember, voting yes tables it and no does not table it.
Okay. So the motion was made by Commissioner Bob Kuna and seconded by Commissioner Brent Reiki to table both public health orders until the January Board of Health meeting and be available to review at that time.
Please call the roll.
Blaine?
Nay.
Thomas?
Nay.
Kasia?
Yes.
Gooding?
Yes.
Jerome?
Nay.
Lincoln?
Yes.
Minidoka?
I vote no on tabling.
Twin Falls?
Yes.
Medical consultant?
Nay.
What is the count, please?
5-4 for the nays.
The motion to table is defeated. The chair would entertain a motion as to what action the board would like to take at this time. Is there any such motion as the action that desires to be taken?
Oh, I'm sorry. Did my motion just go through, Linda, or no? Was
No,
I
it
on
did
mute?
not. No,
Okay,
you were on.
sorry. I
ahead.
apologize. I just read a motion.
That's fine. Go right
I
ahead.
move to approve South Central Public Health District Public Health Order number 2020-1B.
Is there a second to that motion?
Medical consultant, I'll second that.
Okay, it has been moved by Anjanine and seconded by Dr. Davis. Yvonne, would you please read the motion back?
Commissioner Anjanine McCleary, and the motion was made by Commissioner Anjanine McCleary, seconded by Dr. Davis, to approve the Public Health Order 2021-B.
Discussion by the board. Let's go alphabetical. Anjanine?
I chose B because I was trying to take into consideration all of the different counties and the things that I have heard. I think I would be supportive of more restrictions, but I am trying to be mindful of my fellow counties and really would like to see us pass this today. Thank you.
Camas County, Pam?
I would just like to see us, if we do pass it today, to continue to educate and improve our education and reach out to our counties to invite them to join us.
Cassia County, Bob?
I have made it clear in the previous two votes that I am not in favor of a mask mandate, so I cannot make a positive statement.
Helen, Gooding County?
Thank you, Madam Chairman. As of yesterday, the Gooding County Commissioners have rescinded their support for the mandate, primarily because of the jail and the fine amounts. So I will be voting no on this issue. Thank you.
Thank you. Lincoln County, Roy?
No comment at this time.
Minidoka County?
Yes, Madam Chair, this is Tracy. Can you hear me?
The stream is experiencing technical issues. If you can, use the GoToMeeting link to hear audio.